wanna get them again, you're gonna have them sitting, you're gonna be in front of them, you wanna flex their neck slightly so that they're in that plank. So I'm in front of her, I have my hand on both sides, I'm flexing down, I'm telling her to keep, her eyes right on my nose. And then you're just shaking back and forth to kind of loosen them up a little bit, and then you're gonna make a quick thrust to one side or the other. And the side that you're thrusting to is the side you're testing. So if it's positive to the, where you're thrusting to the right, then it's right-sided. And this usually indicates a unilateral vestibular loss. If it's positive to both sides, then it's bilateral vestibular loss or hypofunction, depending on how bad it is. Okay, so I'm gonna shake her head just slowly, and then I'm gonna say, I'm gonna move your head quickly, not thrust it.
Yeah.
Move your head quickly, keep your eyes right on my nose, and then I make a quick thrust. It should be 2 hertz, so it's gotta be kinda quick. I'm usually better to test the patient's right side than using my left hand for the thrust. Just not as good on that. And you're watching to see if their eyes come off and then have to make a corrective saccade back. If it's positive, I usually test it again to make sure that it's positive again. Sometimes people just don't follow direction right, so you need to just make sure that you're not saying it's positive when it's just that they couldn't remember.
Is this the test that we're gonna be today in lab using the metronome?
No,
Nope.
that's the VOR.
The VOR and DBA will do
This
that.
is actually helping you identify if the VOR is intact, but when we actually do the VOR test, that's when we use the metronome. And if the patient doesn't understand the directions, you'll have a pretty good idea, because when you're doing that slow rotation,
They'll like look all around.
their eyes are going like
They're
this.
like, no, look at my nose.